I'd like to present a study entitled Defective Support for Uterine Cervix Induces and Bladder Descent Worsens Overactive Bladder. Overactive bladder has diverse etiologies, of which pelvic organ prolapse is recognized as an important one in female OAB. However, the association between the compartment or degree of POP and OAB remains to be determined. Recently, dynamic magnetic resonance imaging is thought to be useful for delineating the descent of each pelvic organ during abdominal straining without radiation exposure. In this study, we investigate the associations between an OAB symptom score and parameters derived from dynamic MRI findings. OAB-SS has been widely utilized as a diagnostic test as well as an outcome measure for management of OAB in Japan. Diagnosing OAB requires 3 or more points on OAB-SS. We included 118 patients who had POP of stage 2 or less at rest and stage 3 or more when straining during dynamic MRI without remarkable comorbidities and previous pelvic surgeries. Using the sagittal images of dynamic MRI, we measured representative points of pelvic organ, that is, coordinate positions of the bladder neck, the most dependent position of the bladder after straining, uterine cervix, and anorectal angle before and during straining. The x and y coordinates of each representative point were measured before and during straining. POM was evaluated by the distance between coordinate positions of the representative points before and during straining. 35 of the patients had OAB based on OAB-SS. Mean total OAB-SS was 6.74 points in OAB patients. In addition, OAB patients showed higher BMI than non-OAB patients. POM and coordinate positions of pelvic organs in patients with or without OAB demonstrated that POM and coordinate points of BN as well as B were not associated with the occurrence of OAB, while POM and coordinate points of C is associated with it. As shown in this slide, correlations between POM as well as coordinate positions of pelvic organs and OAB-SS showed that POM and coordinate points of BN or B correlated weakly with the severity of OAB. The presence or absence of OAB is associated with POM and coordinate positions, not of BN and B, but of C. Defective support for C undermines the stability of bladder triangle, which results in increased susceptibility to distension of the bladder. In addition, cyclic strain on the peripheral nerves would cause sustained nerve damage, leading to partial denervation of the bladder. This could contribute to the occurrence of OAB. The severity of OAB weakly correlates with POM and the coordinate positions of BN and B. Progressive bladder descent causes BOO, followed by BOO-associated detrusor overactivity. Moreover, bladder stretching stimulates the release of excitatory mediators from the urothelium, which leads to afferent irritability. The progression of OAB could be attributed to these mechanisms. In conclusion, defective support for the uterine cervix is associated with the occurrence of OAB, while bladder descent correlates with the severity of OAB. Thank you very much for your attention. Please take care of yourself.